Good morning, good afternoon, and good evening, and welcome to RF Breakthrough. I'm Bruce Gellin, Chief of Global Public Health Strategy here at the Rockefeller Foundation, and we're so glad that you're here to join us for this episode, Healthcare Takes on Climate Change. Since COVID-19, we've seen a lot of change in both public health and healthcare. The pandemic showed us the serious need for visionary leadership, and as a result, these sectors' influence has skyrocketed, moving beyond recommendations and medical advice to be among the most influential voices for people's well-being. And as we all know, our well-being is directly tied to the well-being of the planet. At COP28, we saw how important this is to the world, as health reached the center of the climate conversations and the recognition that this is not an abstract future problem, but the impacts of climate change on health are already affecting populations around the world. And the point has been made that health is the human face of climate change. It was the importance of leadership and a whole lot of work that led to the success of Health Day at COP. But in the end, the basic building blocks of those next steps begin with ideas. At the Rockefeller Foundation, we know the power of ideas. That power is at the heart of our Bellagio Center in Italy and its legacy of advancing transformational change. There, innovators and change makers from across the globe collaborate and transform ideas into breakthrough solutions that change the world. Our moderator today is one of those people. Josh Karliner is the Director of Global Partnerships for the international NGO Healthcare Without Harm. Josh has led the organization's recent work with the World Health Organization and the COP presidency to secure commitments from over 60 governments for sustainable, low-carbon, climate-resilient healthcare. And last summer, he was a Bellagio Center resident, working on a project at the intersection of climate and health. His idea, captured in an article he authored while in residence at Bellagio, was just published in the Stanford Social Innovation Review. And today, Josh, and an incredible panel that includes a few of his fellow Bellagio Center alumni, will bring that article to life, connecting lessons of healthcare leadership to action that are taking place right now all over the world. Josh and his fellow panelists will share their experiences in activating networks to accelerate systems change in a variety of health and climate domains. And it's a crucial time for this discussion. And in just a few short weeks, leaders will meet in Geneva for the 77th World Health Assembly. Discussions and decisions in those rooms will lay the foundation for the global health and climate response for years to come. And it's a moment where healthcare leadership needs to lead and to recognize that climate change is the greatest threat to human health in the 21st century. And we're sure that today's episode of RF Breakthrough will be a reminder of the importance of that leadership. We look forward to all of you joining in the conversation, so please comment below and post using the hashtag RF Breakthrough. And with that, I'll hand it over to Josh.
Thank you, Bruce. And thanks to the Rockefeller Foundation, particularly the team at the Bellagio Network and my colleagues at Healthcare Without Harm for their support in organizing this important event. The genesis of this session was the work I did as a resident at the Rockefeller Bellagio Center last summer, which resulted in an article which turned out to be the cover story in the Stanford Social Innovation Review this spring. The Stanford Social Innovation Review has graciously made the article available for free until the end of the month, and so you can find it on their website and on the link shown on the screen here. The article describes a process of systems change in the area of climate and health, where the organization I work with, Healthcare Without Harm, our network partners, and many allies have had tremendous success over the past few years in beginning to shift the trajectory of healthcare operations, development, and investment. The article explores some of the key lessons learned along the way. So what we want to do with this session is to dive into those lessons learned with our esteemed panelists and tap their expertise with regard to what it takes to make positive, lasting change in the world as we all work to achieve greater social and environmental justice in these trying times. Before we get into it, though, please allow me to introduce each of our panelists to you. You can find their bios as well on the Rockefeller Breakthrough page. We have three incredible women joining us today, all thought leaders and highly accomplished in the real world as well. First, Reema Nanavaty is an Indian social worker and the head of Self-Employed Women's Association of India, SEWA. Under her leadership, SEWA has grown to become the single largest union of informal sector workers in India. She focuses on women's economic empowerment by building women-owned enterprises and women-led supply chains in energy, agribusiness, food processing, waste recycling, and textiles. Her organization is increasingly focused on both health and climate. In 2013, the government of India honored Reema with the fourth highest civilian award, Padma Shri. There's lots more to tell you about Reema's work, but I also want to share this with you. I had the distinct pleasure of spending the month of July last year with Reema when both of us were Bellagio residents. Since then, we've been exploring ways to build collaboration between our organizations. So it's really exciting to have you here with us today, Reema. Next is Mary Nichols, an environmental lawyer and policy practitioner specializing in air pollution, environmental justice, energy policy, and climate change. Mary has more than 50 years of experience and accomplishments in government, nonprofit, and public service, including serving as head of the US EPA's Office of Air and Radiation and head of the California Air Resources Board. Mary visited Bellagio in March 2023 to write a handbook aimed at Gen Z readers on how to affect long-term social transformations needed to address climate change. So super relevant for this conversation. She is currently a distinguished professor at the UCLA School of Law and a distinguished visiting scholar at Columbia Center on Global Energy Policy. It's a real honor having Mary on this panel. People probably don't say it in this way very often, but I would argue that her work for clean air policy over the years has contributed to saving perhaps millions of lives. Last but not least is Shweta Narayan. She is the global climate campaigner for Healthcare Without Harm. She has over 2 decades of advocacy and community organizing experience on environmental justice issues. Her work focuses on providing legal, media, and scientific research support to the residents of polluted communities and workers exposed to toxic chemicals. She's also worked with state and local governments in India to coordinate the input of health professionals into developing climate and environmental health policies. So full disclosure here, most recently, for the past several years, Shweta and I have been working together to help build a global movement, health movement to take on the climate crisis. During that time, I've learned a tremendous amount from her and continue to be awed by her many superpowers. So that's our panel. Before we really dive in, I want to give our audience some background by way of a quick summary of the story I tell in the Stanford Social Innovation Review article. I also want to encourage folks to chime in on the chat and or at hashtag RF Breakthrough. So please share your thoughts with us as we move through this. The first thing to say is that the climate crisis is a health crisis. This has been apparent to some for a long time, but to many, both working in the health sector and those working on climate, it hasn't been that clear until recently. In the past few years, however, it's become front and center. The World Health Organization has said that climate change is the biggest health threat of the 21st century. The combustion of fossil fuel is already generating air pollution that kills more than 7 million people a year. It's the main driver of the climate crisis as well, that until and unless we reverse it, will kill millions more annually. Essentially, climate change is a force multiplier for health issues. The spread of vector-borne diseases like malaria, dengue, chikungunya is a result of the climate crisis and will increasingly create health problems for people in areas that have not experienced these diseases before. Heat waves and wildfires add to air pollution and exacerbate cardiopulmonary diseases. Drought impacts agriculture and food security, and therefore the health of an increasingly large portions of the population. Climate anxiety is a growing mental health crisis. The growth of climate refugees and migration of people as a result of the climate crisis will overload health systems and the ability to provide care. Health infrastructure, hospitals, health centers, supply chains are under threat from extreme weather events. All of us are affected, and those who have done the least to create the crisis suffer the most. Overall, according to the World Bank, the climate crisis threatens to throw 100 million people back into poverty by 2030. On top of all this is an even less known fact. It's an irony and it's a paradox. Healthcare itself is a major contributor to the climate crisis. It's this premise and the Hippocratic oath of first do no harm that Healthcare Without Harm has based its work on for 28 years. On climate, we were, with a few others, voices in the wilderness until recently, slowly building a base of hospitals and health systems and a growing global network of like-minded organizations. But the going was slow until recently. It was in 2019 that things began to take off. It was then that we set out to find out just how big a contributor to the healthcare was to the climate crisis. And what we found was astonishing. we found that 4.4% of net global greenhouse gas emissions were due to the healthcare sector. If healthcare were a country, it would be the 5th largest climate polluter on the planet. Based on this finding, we built a roadmap to decarbonize the health sector and build resilience and equity at the same time. Based on all of this work, we joined with the World Health Organization and the COP26 presidency, the UK presidency of the COP in Glasgow, to establish something called the COP26 Health Program. And out of that came 2 commitments for climate resilient and for low carbon and sustainable health systems. We expected to get 10 governments to sign on to this in the lead up to the climate conference in Glasgow. We got 52 national health ministries to make this commitment. It was in many ways a tipping point in this work, a catalytic moment for change. Out of that effort came the establishment of the Alliance for Transformative Action on Climate and Health, which is anchored at the World Health Organization. 84 national health ministries now have made similar commitments, with more than 25 committing to net zero healthcare. Last year, the G20 presidency took up climate and health as a key issue. This resulted in the heads of state of the G20 calling for a similar commitment to healthcare decarbonization and resilience, the first time that heads of state have ever addressed the climate and health issue. And then at COP28 in Dubai, more than 145 governments signed a declaration on climate and health, a first as well. A lot of this could not have happened if there weren't a growing groundswell from the bottom up, a cadre of hospitals and health systems, many of them participating in our global green and healthy hospitals network, demonstrating the possible, committing to a vision of a future of climate resilient net zero health systems. What we're seeing now is that major organizations are getting in the game. Large health NGOs, big international institutions, multilateral development bank, large health philanthropies like the Rockefeller Foundation, national academies of medicine, major health professional associations are all taking on climate and health. The trajectory of healthcare and health development is shifting significantly to address climate. There's a lot of work to do still, but transformational systems change is underway as the sector moves toward net zero and resilience. What's more, a movement is emerging, and it's not just to reduce healthcare's climate footprint, which is important, but it's bringing the health voice to the climate fight in bigger and broader ways. One example last year in the lead up to COP28 was that organizations representing 44 million health professionals called for a rapid phase out of fossil fuels and a just transition. So that's a brief background. The rest is in the article. The questions that I asked during my time in Bellagio was, what are the lessons we can learn from this recent success, and how can they be applied to our ongoing work? And more broadly, to climate change, to health, and to other social movements. I came up with 4 lessons, which I want to use as a basis for our conversation today. These lessons are, 1, the pandemic was a prologue, and we can learn a tremendous amount from it. 2, networks focused on defined outcomes can accelerate systems change. 3, scaling up means letting go. And 4, a society-wide movement for a just and healthy transition away from fossil fuels is essential. So let's jump in. Lesson 1. The global pandemic gave us an insight into what a multidimensional crisis on a planetary scale looks like. It was an unfortunate insight that we had to have, but it gave us a look. So I guess the question is, what are the biggest lessons that we can learn from the pandemic in terms of systems change? One person that I asked when I was working on the article said, a connected and networked world backed by commitment to respond to an existential threat can unleash ingenuity and innovation operating at an unimaginable speed. So there's a lot of insight into how we can move quickly to transform society to address a crisis. A more jaded view is that we've kind of reverted to business as usual, in a lot of ways. Everybody wants to get the pandemic behind them. Nobody wants to think about it or talk about it. And so I guess my question to the panelists is, what do you think? What are the lessons that we've learned? And I'd like to start with Shweta. Shweta, what are your thoughts on this?
Well, first of all, Josh, congratulations on publishing this article, and thank you for having me over here. And quickly on the the fact that we want to forget about the pandemic is because the pandemic was a trauma. I think if we share, I think almost everybody knew somebody who had lost a near and dear one, and we want to forget about it. It's a very traumatic episode. To me, the lessons from the pandemic are super important. The first lesson is that, as you said, when governments want to act, they do get their act together. Why is it not happening when we know that the climate crisis is accelerating is a good question to ask. The pandemic also showed how deeply human health and planetary health are interconnected. Are we really reflecting on the lessons as things go back, as you said, business as usual? Are there any lessons learned from that? Is a question that we need to collectively ask. But most importantly, from a health perspective, I think there were very, very significant indicators that we must consider while going forward. First of all, as a society, our health systems are not prepared for multiple stresses. Let's face it. We've started focusing on pandemic. All the other services were abandoned or left halfway that had impacts, that had collective impacts. We celebrated, and I have my utmost respect to the health community, the health professionals, the doctors, the nurses, the frontline responders for the way they saved lives. They got together and we celebrated that resilience. But let's face it, that resilience was not out of choice. It was not that they had opportunities to be resilient. That resilient was because they had no other choice. And as health professionals are committed to save lives, they did what they had to do. We cannot expect to continue working on that resilience without empowering the health professionals and the health community. And I would say the biggest lesson is, and we say this, the pandemic is a preview to the disasters that's to come, especially when we're looking at the climate crisis. The injustices and the inequities that made pandemic worse in terms of vaccine and inequities, in terms of access for different governments and people to get resources should not be repeated. And that would be my biggest lesson going forward from the pandemic.
Thanks so much, Shweta. Mary, what are your thoughts on this?
Well, I have a slightly less optimistic view, I suppose. Having lived through the pandemic in Los Angeles in a wonderful situation where my son and daughter-in-law and grandson had just moved in with me, and we had room for everybody and ability to all be connected and to help each other out. Even before the vaccine was available, I was being protected and, things were done. It was absolutely wonderful. As an old person, I benefited enormously from having had family around me. But the lack of reliable information from the beginning, I remember trying to hand stitch a mask for myself and not being sure whether I was doing it correctly from a pattern that somebody had published online. And the trajectory of that to the point where now there's all the confusion about whether it's okay to wear masks, not okay to wear masks. It seems to me that we have failed to really draw lessons from the response appropriately. I have to give credit, of course, to those who did step in and make the attempt to give accurate, good information, but it's politicized, among the states to this day. I think in the U.S., I do think your introduction sort of alluded to this, but the fact that the healthcare industry itself has recognized responsibilities in this area is helpful, but I don't feel that we're better prepared now than we were a few years ago.
Reema, what's your sense? Are there positive lessons we're drawing, or have we just kind of gone back to business as usual? And how does this help us deal with the climate crisis in health?
Thank you so much. And I will bring the voices of the 3 million women workers who were all, trying to address a new kind of crisis that which they had not even really thought about. They did not know what is this pandemic all about. Living in a small little hut or in a small little house in a village, how do you isolate yourself when you are fetching water, 1 mile or 2 miles every day? How do you do continuous hand washing? These were things which were really very confusing and very new for our members, and therefore I think the whole focus was on Medicare, while I think this was also a great opportunity to focus on healthcare, the health and well-being of the people, but also of the planet. We all experienced that when there was lockdown, the air quality improved. There was less of pollution in the air. The biodiversity also increased. And I think what we really lost as an opportunity was how do you focus and improve the healthcare in general, the nutrition, the food intake, the education and awareness of the people. And I think that is what is one needs to really focus on when we talk about climate and health.
Yeah, I think that's super important. And it was interesting. I was in a meeting of the G20 Health Working Group in Brazil a couple of weeks ago, and they were talking about how to prepare for the next pandemic. There was sort of a couple of different opinions about it. One was preparing for the next pandemic, and the other one was about how we strengthen our health systems so that they're robust and resilient, and that they're prepared for multiple threats. And that seems to me to be one of the important lessons that's coming out of this for the health sector, is that the climate crisis, again, will be like could make the pandemic pale in comparison, and our health systems need to be prepared. Shweta, and then I want to move on to the next question. Please go ahead.
And I was listening to Reema ji, and one thought that came to my mind was we don't give enough importance to community and their role in averting a major crisis. And I think community and building the community and strengthening community is at the center of what we're doing. I mean, the history again, look at HIV, AIDS, look at COVID. I think the role of community, the importance of connecting with community and building a resilient community is at the core of even building resilience in healthcare. So I think we really need to think about that when we're thinking about health.
And I would, Josh, say that when you said, how do you prepare for the next pandemic? Do we really need a pandemic to prepare ourselves? But I think the community will have to become really more resilient. And unless and until the community is empowered, the community is strengthened, the community is fully made aware on the climate crisis and the related health crisis, the interconnectedness of the two, I don't think we can prepare ourselves just by improving the health infrastructure, just by producing more and more vaccines. I don't mean to say that eats either or, but I think it will have to be a very integrated and a holistic approach that one will need to prepare for the next pandemic, or to avoid or avert the next pandemic to come in.
Well, that brings me to the next question, really. There's, it's one of the age-old questions when we think about organizing for transformative change, is that can or should this change come from the top down or the bottom up? And what's the relationship between the two? And in that context, it's sort of the second lesson, I think, around a network-based approach that focuses on clear, defined outcomes. And I think the question is, really, where do you start? And what's the interplay between the community-based grassroots action and building policy at the national and international level that we all know we need to have in order to address the crisis that we need to address. So, Mary, you and I were talking about this the other day a little bit. I'm curious, what your sense is as somebody who's been a policymaker at the national level and at the state level in California, which is now the fourth largest economy in the world. What's the interplay here?
I think that the bottom up and the top down are both essential and have to be implemented simultaneously. And then when you add in the diversity of sectors that are involved in addressing climate change, you have to have an ongoing interaction that's almost so complicated you couldn't even graph it, because everybody has to play a role in some way, even if it's not the most central issue to everybody who's involved. But you have to have a change ultimately in the minds of sufficient numbers of people to give support to the policymakers to do things that will seem very difficult, especially in societies where, like ours, the political leadership is quite dependent on support from the largest existing incumbent suppliers of the products that are causing the problem to continue. But it's also a question of adaptation versus mitigation, which is now increasingly important, I think, because we cannot at this point, even if we shut in all petroleum development, escape the ongoing effects of climate, what's already in the atmosphere that was placed there over the last century and more. We're going to have to find ways to protect ourselves and to physically remove some of the carbon from the atmosphere, and that in turn sets off its own set of chain reactions. So I guess my shorter answer to your question is there is no either or here. It has to be both.
So give an example of how that both and kind of approach has worked in your experience. What's a really good example of how you've had both the top down and the bottom up coming together to forge change?
Well, I think in my experience in the world of transportation, the regulatory authority that we had at the state and federal level was only really utilized once the auto industry became convinced as a result of some litigation and ongoing political pressure that they could take action. And there were technologies that came forward that made it possible to drastically reduce emissions. But if the public had not been aware of and willing to support and demand that the car companies produce cleaner cars, we couldn't have gotten there, because it is a market out there, and it's a market that's dependent on millions of people making choices as to what they're going to buy. So it seems to me that and it didn't happen overnight either. I mean, this was despite the fact that air pollution was seen as a health crisis, and I believe it is a health crisis. It's not something that one piece of legislation or one set of actions is going to solve quickly. It took years to actually make the changes take hold. But during that whole time, there had to be a continuing commitment on the part of the agencies, the leadership, but also ongoing willingness on the part of the public to believe that air could be cleaner and that it needed to be cleaner.
Well, you just said a lot there. So, I mean, a few things that I just pulled out of that is the need for leadership and a vision for the change, public pressure, market pressure, technological transformation, legal strategies, and regulatory approaches. So all of those, it sounds like, combined to make the changes. And I'm assuming you're referring to California's clean air standards that have sort of led the United States in
Right.
in addressing air pollution. So
Yeah.
yeah, that's that sort of brings together all these different pieces. Reema, I'm wondering from your perspective, you work on the ground with self-employed women, low-income women in a lot of different, both rural and urban settings in India, a really different situation than Mary's. How does this sound to you? And like, what's the relationship between the work you're doing on the ground and achieving policy at the state level or at the national level in India or in other places that you've worked in the world?
I think I agree to what Mary said, that it's not either or. But at the same time, I think we do need to realize that the women workers, the poor in the informal sector, are disproportionately affected by climate crisis. And there's absolutely no detailed information. There's no data on what are the effects of these climate crises on the livelihoods, on the health, on the access to energy, on the food and nutrition of these women workers in the informal sector. And I think the poor and the amongst the poor, the women, they're not going to wait for the policies or the programs to come about, because for them, adaptation is their day-to-day coping and survival strategy. And so, therefore, I think one of the biggest lessons that comes out from our experience is that these climate actions or this adaptation by the poor and the women in the community needs to be recognized and taken to scale by the policymakers. So that's the biggest and the most important lesson. And I think when we were completing 50 years of Seva's organizing, the biggest message for us was that how do we plan so that we are able to celebrate 100 years of organizing. And that's where we launched what we call it as our Building Cleaner Skies, or the Swachh Akash campaign. That how can the 3 million women workers and their households, take up climate action on their own in their smaller ways. But when smaller bits come together of 3 million, that has a very significant impact on the adaptation as well as on building resilience of the communities. So I think it is these smaller actions which are really helping adaptation, building resilience by the women in the communities, by the community groups, by the federations or associations, needs to be strengthened in terms of appropriate mechanisms for scaling up with financial resources and enabling policies.
So that's really great. And do you have any examples that you can share of actions taken by the poor, by the constituencies that you've worked with, that have actually been taken up by policymakers and then created the space for more action to happen on the ground, that kind of interplay? Is that something that, even if it's not in the climate and health space, I'm curious what some of the learnings might be.
No, definitely. I can share several, but I would like to specifically highlight our green villages or the green chawls approach. So, you do household energy planning and budgeting. So that gives you an idea what's the affordability of the households, what are the major energy needs of the households, and then you enable the households to move to greener and cleaner energies. Then you aggregate it at the village level, aggregate it at the cluster level. And I think that gives you ample opportunities to build a cadre of climate entrepreneurs. And, these entrepreneurs, it's a new green skills, green livelihoods. How do you link them to the vendors, to the financial institutions? And you provide access to greener and cleaner energy. And this is what I think the government is now looking at. How do you incentivize the local village councils, the local municipal councils who adopt this kind of an approach? The second approach that I think which has really worked well is when you offer a menu of green and cleaner tools and technology, how do you link it to the carbon market to make it more affordable to the communities? And we have seen that happening with access to solar pumps, access to biodigesters, and first time we have seen that women have set up their own microgrid. So I think these are some of the initiatives which are being taken by the government, adopted into policies, and that's enabling, throwing up ample opportunities in green skills and green livelihoods.
That's amazing. And it's in a way, it's building a just transition from the bottom up, which is really exciting to hear about. Shweta, so
we call it as climate justice,
Mhm.
so that the communities in rural areas or in the urban slums are not at the receiving, or they're not the dumping ground, but how can they be equal negotiators? And that's what real climate justice means.
Awesome. Well, that's a great segue to Shweta, who has been both working on climate justice issues on the ground in India over the years, and now also you're working globally with global networks to try to forge the change. What do you see as the interplay in the relationship between this top down and bottom up? And what are the roles of networks in actually forging transformational systems change? When does that work? When does it doesn't? When doesn't it?
I mean, I echo what my co-panelists have said, that both are necessary, top down and bottom up. In fact, the situation that we are in and the scale at which the climate crisis is accelerating, and that it's almost like we need everything everywhere all at once. So there's no question about it. Having worked in the health community with health networks, I think in addition to top down and bottom up, I think there is another aspect that we need to work, especially with the health community, is the lateral mobilization. The health professionals, the health voices, who are the most trusted, among the most trusted and credible voices, themselves need to be organized. They need to come together, because I feel that they are this crucial link between the top down and the bottom up. The health evidence that health professionals, the doctors, nurses, frontline responders, community health workers see on a daily basis provides that validation for communities who are organizing to create that groundswell for demand for better policies. And the same evidence that is so robust that physicians are seeing in their clinics also forms the basis for evidence-based action at the top level. So they are the health community, the health professionals are the link between the top down and the bottom up, and there needs to be focus in organizing and mobilizing their voices. And we have seen, and there is a rich history of the health community influencing the society the way we are today. The progressive wins that we have gained for the last 150 years. We've seen there is a role of the health community. When we analyze issues from the lens of public health, things change, narratives change, and people come together. So I think health is a shared narrative. It's a shared concern. It has the power to sort of transcend boundaries, bring different people together. And that's where the health networks become very important, to convene other networks, be it the gender justice groups or environmental justice groups or indigenous groups or the climate justice groups. I think at this point, we need everybody together. The power of these groups will influence action. And the health community and the health networks can have the moral authority or moral standing to convene all the other groups. So I think this is a really powerful moment that we are in, and we totally need to leverage it if we want to have a healthy future or a chance of a healthy future.
And yeah, health is everywhere, right? The health we have, all of us engage with doctors and nurses and health professionals in our lives. There are local health authorities. There are state level or subnational health authorities. There are national health ministries or Department of Health and Human Services in the US. There are global institutions that address health. So health can play a super important role. It's 10% of world GDP too. It's absolutely right. There's already this huge network, if you will, of health systems out there, which kind of brings me to the third lesson here, which is called scaling up is letting go. And it's sort of like the let 1,000 flowers bloom lesson, if you will. And in our experience doing this work, we've seen this sort of initial small group of us that were working on climate and health transcended by the engagement of this huge sector in this issue. And so now we have major international institutions, dozens of governments, millions of health professionals, lots of different NGOs getting involved in this work. And in some ways, I think this third lesson in the article is about getting beyond our own egos, both as individuals and as organizations or institutions, while helping an ecosystem flourish. So I'm wondering if each of you can sort of take a moment to talk about a time when you or the organization or institution that you were working with had to let go, and had to let go in a way that allowed others to take the space and to sort of really expand the work. I'm wondering, what this lesson might mean to you. And Mary, I'm going to put you on the spot and get you to go first.
Because I'm the one who has experience as a bureaucrat, right? So I think that I can really cite the beginnings of the California climate program, the legislation that was passed, and the mandate that was given to the agency, the Air Resources Board, to develop a climate plan. And one of the first things that happened was that we opened up a website for people to make suggestions or give input to what they thought should be done. And, it broke the internet, as they say. I mean, the public response was overwhelming from academia, from citizen groups of all kinds. But in a way, it was sort of so big and diffuse that the agency really didn't know how to cope with it. And so we then began to try to implement a plan that we wrote ourselves. And it became clear that we could not do that without a huge amount of additional support that wasn't going to come from hiring new people, because we wouldn't be given the authority or the funding to do that. And that it was going to have to come through community-based organizations and really local governments being willing to step up and take action. And that what they were demanding of us was more in the way of useful information and connectivity than of actually running the program. And I think that's a change. I suppose it's in the direction of bottoms up, but it's really in the direction of just being more effective in terms of deploying the assets that the government has in the direction of supporting the people who are actually going to have to, whether it's putting the solar roof on or opening up a cooling center inside of a community building, or any changes in the infrastructure that have to come really from local organizations. So I think that's a change that is sort of ongoing, but I think it is. I think it definitely is underway.
That's that's super important, and for probably one of the hardest places to let go is for a government institution to actually do it in a way that empowers other people, because the tendency is to hold on so tight, and things are so rigid in institutions like that. Shweta, coming from the more of the NGO world, what about you?
Well, I mean, to be honest, this has been the toughest sort of point when I mean I've read your article, and this was for me a big moment to pause and really introspect, because this is the hardest. I mean, it's so ingrained in human nature to be constantly be part and hold on to things, but it's also like it's a in many levels absolutely true that, like, if you want to scale up, you will have to let go, you will have to share power and control and hope for the best. Coming from the NGO perspective, one of the constant fear in scaling up is also when you scale up, there is and especially from a justice perspective, you look, there is a risk of being co-opted and the message getting diluted. But having said that, I think, again, the situation that we are in collectively, we not only do we have to scale up, but we also have to ensure that there are local solutions to the problems. And it's not replicating a solution that might work in a context, would not probably work in another context. So it's not just scaling up, but it's also creating an opportunity for, as you said, 1,000 flowers bloom, but those 1,000 flowers don't have to be the same flowers. It has to be different solutions in different geography and different contexts. And there needs to be a space to share that knowledge and to share that understanding and power to be able to somehow figure out this this complicated situation that we are in and resolve or build a community which is way better and not competitive in some ways or the other.
That's very insightful, and it is such challenging stuff. So Reema, have you figured it out?
So, Josh, I was just thinking, when we don't have anything, what do you let go? And I think, the members that I work with and, who are struggling for their survival. So, do you let go the lives of the people to scale up, or there will be nothing left for scaling up? And I think that's where one needs to really go about is that, how do you build local decentralized supply chains? If you are a large global supply chain, or you are a large national supply chain, then scaling up you may have to let go. But I think here the question is that, how do you build local decentralized supply chains? How do you cut down the distance between the producer and the consumer? And that only will generate an ample of employment opportunities. And I think one has to look at a very holistic and an integrated approach. The only lesson that I think, or the message that we have, is that one should let go working in silos. But I think what one has to start thinking about is on interconnectedness. How do you work with a very holistic and an integrated approach? So that's the lesson that I have, of letting go to focus only on health, to focus only on economic empowerment, to focus only on energy, but I think only on food security. But how do you work in a very holistic and an integrated approach?
Well, you said two really important things, at least there, Reema. And one of them was that it's really important to recognize that people who it's hard to let go of something if you don't have it. But what I heard from all three of you was that a decentralization of power is part of the solution here and part of the lesson. And then Reema, your comment on silos and moving to a more integrated, holistic approach to things leads me to the fourth lesson. So a perfect segue, which is really about going to the root cause of the problem. And so, in the case of Healthcare Without Harm's work, it means helping build a cross-sectoral, society-wide movement for a just transition to phase out fossil fuels. So, despite the large-scale systems change that's underway in healthcare itself that the article kind of talks about, the climate crisis is accelerating and morphing more rapidly than the transformational shifts that we're able to achieve. So one of the things that we're, I think all of us always grapple with is how do you balance sort of pragmatic success, making specific changes, whether it is getting a zero emissions hospital or supporting a community to have access to credit and sustainable practices and technology, or to getting a specific regulation in place, or things like that. How do you balance that with building a broad-based movement to address the root cause of the problem? And the problem here is what the UN Secretary General Antonio Guterres has called an existential threat to civilization, the climate crisis. So what are your thoughts on this one? Each of you, and I'll, instead of choosing one of you, I will let whoever wants to jump in first.
May I? And I think what we feel is that, access to clean air and access to healthy environment and clean air is a fundamental right of every living being on this planet. And that calls for how do you lead a whole movement or a campaign where you are one with the nature. And that's the kind of a fundamental shift that's needed so that we are all able to have, a cleaner and a better future for not just us, but the generations to come.
I would only just add to that we see that in places where there's rising prosperity, there's also rising hope and rising demand for clean air and for a better environment. That as people become more prosperous or have an opportunity to feel that they can have a better life for themselves and for their family, that one of the first things that they turn to is the quality of the physical environment that they live in. And so climate is inextricably tied to economic and social policy.
Just to come in over here, and I just want to echo what Reema said earlier. I think even as a solution, breaking the silos and forging connections and conversations is super important, even more important now than ever. In terms of like responses, I would break the responses in short term and long term. And the short term response is absolutely no-brainer that fossil fuels are the root cause of this crisis that we're facing. It's not just the fossil fuels, the social and economic model that is built on a fossil economy is the root cause of the problem. And we need a just, rapid, and equitable transition away from fossil fuels, where communities, people's well-being, planetary well-being, and health is at the center of that transition, whatever that future we are trying to put together. And in all of this, I think people have to take charge, but we all have to hold our governments accountable. That's absolutely important. The action for any meaningful action, the window is really, really fast closing, and we need to hold the policymakers, the government, and evidence is clear. Most recent article is that there are 57 fossil fuel companies that are holding everybody at ransom. We know who the culprits are. We need to hold them to account. And again, if we want to have a livable future, I think the long-term indication that we're seeing and the place that we are in, and I'm going a little bit outside just in terms of looking at the crisis that we're facing right now. We are going through some of the toughest times in history, with conflict, with violence, with nature, and its own form of violence with extreme weather events, and the public trust in institutions, in governments, in international law is at its lowest. So what we really need is the collective healing of our communities. So the long term if we really want to have a chance, is to repair that trust, to bring communities together and have a co-created shared vision of a future that is not just benefiting one class or one geography, but that's truly held by the people for the love of our children and grandchildren. So I think we really need to have a shared, different narrative. I wouldn't even want to fix the current problems. I would probably take the leap to create a vision of a world where we learn the lessons of inequities from here to ensure that that's just.
Well, that was a pretty good definition of transformational systems change at its largest. And I just want to thank the three of you for taking the time to come and have this conversation. I feel like we've just barely scratched the surface. It feels like this might be, worth another month at Bellagio just to hang out and figure it out. But it also is is something that we are all that people are grappling with every day, right? And it's people on the ground who are living living this reality and impacted by health crisis and climate crisis in so many different ways, and are forging the solutions on the ground. And those of us who are sitting on this panel and those of us who are attending this conversation online are in a position to actually privileged position to think about this and to and what this has been an effort to do is I think is to try to share a little wisdom and share a little bit of thinking. And there's probably a lot more that's coming through on the chat that is that people are thinking about, and I just encourage people to articulate in different ways, what some of the big picture thinking and solutions might be, because I think we, in our daily lives and in our work, we're going about it piece by piece, pragmatically as we have to, but we also have to keep this big picture in mind, especially as Shweta said, in the moment we're living in. So we're going to have to wrap up now, and we can still keep the conversation going, though. You can comment here or you can post using hashtag #RFBreakthrough. I want to thank the Rockefeller Foundation again for hosting this event. And if you want to learn more about the Rockefeller Foundation Bellagio Center and the residency program, you can log on to the Rockefeller Foundation website. If you want to see the Stanford Social Innovation Review article that this conversation was based on, go to the SSIR website. It's available for free for a little while longer. And I do want to thank the panelists one more time. It's been a great conversation. So thank you very much, and looking forward to the next one.
Thank you. Thank you so much. Thank
It's been
you.
a pleasure.